Hey everybody, welcome to Smoky Mountain Echo, Haywood County, North Carolina's new podcast. I'm Dylan Huffman. Today we're going to discuss 988, the Suicide and Crisis Lifeline. In response to the rising mental health concerns in our community, the Haywood County Health and Human Services Agency has adopted the National 988 Lifeline as a local resource. The goal is to provide immediate support and connect people in crisis with trained professionals. The 988 Suicide and Crisis Lifeline provides free and confidential emotional support to people in suicidal crisis or emotional distress 24 hours a day, 7 days a week across the United States. The Lifeline is comprised of a national network of over 200 local crisis centers. The counselors will listen to you, understand how your problem is affecting you. They're going to provide support and then get you the help that you need. 988 is funded by the Substance Abuse and Mental Health Services Administration, and it is administered by Vibrant Emotional Health. And 988 can help with a variety of concerns, including depression, anxiety, substance use, suicidal thoughts, mental and physical illness, loneliness, trauma, relationships, emotional worries, and a whole lot more. You can call or text 988, but you can also use the chat option that is available at 988lifeline.org. That's 988lifeline.org. However, you should know if you are experiencing a medical emergency, you should call 911, not 988. When you contact 988, an automatic message is going to guide you through available options. The call is then routed to the nearest crisis call center, and that's locally managed here in Haywood County by VIA. And it's based on the first 6 digits of your phone number. Your privacy is, of course, a priority, and the Lifeline protects all confidential information that is shared during the call. Option 1 when you call 988 is dedicated to veterans, service members, and their families. It's going to connect them to the Veterans Crisis Line. This service is free, it's confidential, and it's available in English and Spanish. There's also a translation line for additional languages. This service is also available if you're worried about a family member, a friend, a coworker. You can call and get some support on their behalf. Let's talk a little bit about some 988 misconceptions. A lot of people wonder, if I call 988, will police be dispatched to my location? And the answer to that question is no. The goal of 988 is to reduce the need for police involvement and instead connect you with counselors who can help. 988 counselors do not have the ability to identify who you are or where you're located. Another frequently asked question is, how are 988 calls routed? So when you call 988, your call is routed to the nearest crisis center based on the first 6 digits of your phone number, and that's going to include your area code. That means it might not connect you to a center that is near your actual location, especially if you might be traveling or if you have a phone number with a different area code. Are 988 calls tracked? 988 counselors do not have the ability to identify who you are or where you are, as we said earlier, and this emphasis is on privacy. It's to ensure that callers feel safe and comfortable when reaching out for help. The average answer time whenever you call 988 is typically under a minute. However, sometimes, it could be a little bit longer. I have Sarah Banks here to talk to me today, and she is the Public Health Director at Haywood Health and Human Services. Sarah, how are you today?
I'm good. How are you?
I'm good. I was reading an article, and it says that the North Carolina Department of Health and Human Services says that in North Carolina, we saw a 31% increase in 988 calls for support just in the past year. 31% increase. Mm-hmm. Why do you think that is?
First and foremost, I think it's because it's out there. Those of us at the local level have really taken it and pushed it. This initiative is a statewide, nationwide initiative, and we were really encouraged and charged to push it within our communities because we know that every community is different. The needs are different, whether it's cultural diversity, socioeconomic status. And so at the local level, we really try to meet the needs of the community and meet people where they are. So first and foremost, I think it's because people are just seeing it. It's out there. It's available. Another reason I think is because it's so easy. You know, the majority of the population walks around with a cell phone in their pocket, some of us more closely than others. Yeah. And it's literally at your fingertips no matter where you are. So I think it's easy and it's available and it's visible.
Why do you think it is such a needed service for people in North Carolina and, you know, especially here in Haywood County?
Well, I mean, we all know that mental health resources are very scarce. There are never enough resources. I hope that there will be a day when there are enough resources, but it's readily available to anybody and everybody. There's no in-person doctor visit. There's no insurance. There's no worry with, you know, knowing somebody at the office that maybe your confidentiality might be compromised or worrying about that, though we know in healthcare, you know, your confidentiality is always our first priority. And, you know, I think some of the stigma with mental health is breaking down a little bit, and people that wouldn't normally ask for help are asking for help. And this allows people to have a conversation with a trained professional in the comfort of their home, in their car on their lunch break, you know, in their office at work, you know, at night, in the morning, any hour of the day. It's become so readily accessible to people. And I think availability is key. You know, not everybody has, you know, insurance that will cover seeing a mental health provider, or they are a single mom or dad and they've got 2 kids at home and they're juggling life and juggling work and they're just not making time for self-care. This option allows them to do it all. It allows them to take care of themselves so that they can be the best parent or spouse that they possibly can be and take care of themselves while they're taking care of everybody else.
And there's absolutely nothing wrong with asking for help.
Absolutely not. And that's the biggest part, is breaking down that stigma of, you know, a weakness associated with asking for help. Life is hard.
Yeah.
Life is hard. You know, we're torn in a million different directions. We have expectations from, you know, management or family or even of ourselves. I'm so critical of myself, it's ridiculous. So, you know, living up to those expectations and trying to be everything for everybody. But what we want people to know is that it's okay to not be okay. And we want you to ask for help and we want you to make time for yourselves. You know, this has been a really big passion project for my staff. They have really been devoted to this initiative from the moment it hit the ground, because we see so much of it in our community. We see, you know, substance abuse, we see alcoholism, we see, you know, suicide numbers going up. And so people just need to know that there's somebody there.
Sarah, thank you so much.
No problem. Thanks for having me.
988lifeline.org has a page dedicated to testimonies from people who have used the service. It's 988lifeline.org/stories. One person says, "For the first time in my life, I am learning to visualize my future instead of remembering my past." Another person said, "Suicide is still a topic that is not talked about nearly enough, and it's a detriment to us all because it leaves people living with suicidal feelings and, you know, they suffer in silence. I'm alive today because there are people around me that I can reach out to when I am suffering." Community involvement is crucial for the success of this initiative. Together, we can make a difference in our community. And please remember, 988 calls, texts, and chats at 988lifeline.org are available 24/7 and they are free. However, if you are experiencing a medical emergency, you should call 911. This is Smoky Mountain Echo, the Haywood County, North Carolina government podcast. Whether you're a longtime resident, a newcomer, or just curious about the workings of local government, our podcast is your go-to source for staying connected and informed. New episodes are available the last Tuesday of every month, and they're always available on demand. You can check out our website, smokymountainecho.podbean.com. That's smokymountainecho.podbean.com. I'm Dylan Huffman, Haywood County's Public Information Officer, and we'll see you next month.